Hello, everyone. This is Craig Hunter, Senior Vice President with Coker Group, a national healthcare advisory firm. And for the last couple of years, Coker has provided an APP strategy and oversight survey. And with me today is Matt Jensen, Vice President with Coker and leading our data analytics component, and Alex Kirkland, Senior Vice President over our physician compensation, design, and fair market value work. And they're going to explain a little bit more about the survey and how it came about, the details of what's included, why we think it's important, and where we see it going in the future. So from my perspective, before I ask the two experts to join, APPs are playing a much more important role within the care provided within our clients. And I think nationally that's the case. And I think it's even going to continue to grow more so in the future. The feedback that we have gotten has been there's nothing else like this in the marketplace, primarily because it's not just focused on actual numbers. It's more structured on how their programs are focused, coverage requirements, support mechanisms, compensation for various types of roles of oversight for them, those types of things. But it's just been very good from my perspective, because our clients are very interested. We've had non-clients or other larger health systems across the country inquire about it. And I just think that this is a tremendous opportunity to provide some very valuable information to the marketplace. Matt, if you don't mind, take a minute and give us a little bit more detail about what's actually included in the survey, how it came about, what you were trying to really address specifically, and then we'll get Alex's input as well.
Thanks, Craig. Matt Jensen, Vice President at Coker here, focusing, as Craig said, on data analytics. We have a revenue analytics service offering that we offer here. I'm going to go into a little bit of the overview of the survey here, but before I do that, why don't I just kick it over to Alex real quick to introduce himself, and then I can go into some of the details about the survey.
Thanks, Matt. Alex Kirkland, Senior Vice President at Coker. I usually say that I lead our physician compensation strategy practice of designing comp plans, and I need to be saying that I lead our provider compensation strategy design of comp plans, because it's not just physician comp work that we do. There's a lot of APP work, as we'll get into the survey, making sure that organizations have a compensation model that recognizes advanced practice providers as providers of care within the organization, as opposed to more something that treats them as nurses, I think is a key differentiator. As such, we've designed and developed numerous advanced practice provider compensation plans. Matt, why don't you go into some of the background of the survey and context on the data collection?
Perfect. Thanks, Alex. So with the APP survey, we started this back in 2022 was the first year. Our goal is to run this every other year. And we have really focused on trying to fill some of the gaps observed in available data that's out there. A lot of the other compensation surveys that are widely used within our industry focus, like Craig said, on the numbers and the compensation metrics and productivity metrics. And we really wanted to understand some of the more qualitative parts of what goes on with compensation and organization of APPs in various organizations. We focus on the actual organization of APPs, so the organizational structure, utilization strategies and recruitment strategies with APPs. We did focus on physician oversight of APPs and work expectations. And then we do have some more quantitative aspects to the survey in the results that we present. This really comes about in our minds because of the increasing demand for APPs in our industry. There's constant talk about physician shortages, and the growth in physician assistants and advanced practice registered nurses is above 25% over the next several years. If we look from the Bureau of Labor Statistics, I think it's 27% for PAs and 38% growth for APRNs between 2022 and 2032. Real quick, I can highlight some of the things that we have here from our survey. So for 2024, we had over 4,700 APPs represented in our survey. I think that's a significant metric here. That also represents over 6,000 physicians for those same organizations. Quite a robust
Man, I think
grouping.
that organizational makeup, we've got a vast network client base that we extended the survey to, but it's of all different types of practice types, meaning it's not just employed, it's not just private practice. It's a mix of both. It's probably going to be heavier hospital employed, given that's what most of the provider arrangements are found within these days.
That's right.
I think we've got a makeup of those that are physician-owned practices, hospital-owned practices, corporate-owned practices that have private equity stakes. So it's a big, vast representation of all different types altogether. I think those organizations, as Matt was saying, have over 6,000 physicians, over 4,000 advanced practice providers represented with them. And then it spans all geographies across the country. So I think those some good insights is comparable, I think, results that we saw in 2022 when we launched the survey. And so what was neat this time is we were able to trend some of the results as well to see how the answers or the responses came in compared to how they came in last time, to see if there was movement in certain areas. And we showed some of that in the report. So there were some areas where we saw some movement. I think more than anything, those trends were a continuation of what we would expect, driving things in a certain direction. We got into qualitative reasons as far as when organizations would think about adding APPs, what physicians are thinking about in terms of their willingness to collaborate with them, provide that supervision, those types of things. So it was a good swath of respondents that we got that gave us some insights. From what I've been able to gather from our clients, I wouldn't say it was overly surprising, the responses, but it was validating for what they thought. And there may have been, this is how are we doing it right? And I think the survey, from what we've heard, was helpful to help organizations understand, okay, we're on the right track. This is what we're seeing elsewhere. This is how others are doing it. Or to understand, okay, we are a little bit outside of the norm. Let's shape how we're structuring something given to whatever the question or topic was within the survey. I think it's helped validate some of the thoughts and directions that organizations were headed down. But we got into strategy as well. How are APPs treated within the organization? Is HR in charge of them, or are they within the medical group? Are they employed? They have contracts or agreements? Are they under letters of employment or other types of arrangements? How sophisticated is the comp plan versus is it more like a nursing comp plan where they're paid on an hourly basis and there's a merit increase? So we got into some of that and had the opportunity of talking with a lot of different clients and follow up about some takeaways from the survey, how they're utilizing it, and how it may influence how they update their strategy.
Yeah, and I'll note another important point is we did break down the APPs into broad specialty groupings. So we've got primary care broken out from specialty care, surgical care, and then various hospital-based specialties. So anesthesia, emergency medicine, and then other hospital-based specialties. And it was interesting, I think another point going from 2022 to now 2024, some of the trending as COVID has wind down in importance. We did see some updates to the metrics for hospital-based emergency medicine APPs, especially that were changed due to the nature of COVID changing. So interesting metrics there.
Yeah. And I've recently been working with a large hospital-based client or health system client that has numerous hospitals in a major area that is trying to grow their mental health practice through APPs. And so they're trying to develop a model that has physicians overseeing around 5 or so APPs to help reach out all of the demand within the area, the mental health needs that there are. Our survey provides some thoughts and direction in terms of that specific use case of it, how organizations may evolve their strategies and plans. And then a specific area I wanted to comment upon within it, Matt, you alluded to it, was we captured several questions about the physician oversight or collaboration with the advanced practice provider. In our work, we're hearing more and more about not just desires, but expectations of physicians to have some type of oversight stipend. We got our consulting guidance on how does the APP provide a benefit to that provider. And if it's that it allows the physician to be more productive, they're on a work RVU model, it may be appropriate that there's no stipend available. But to the extent that the APP is managing their own panel of patients and the physician is having to do chart reviews, answer questions, more of the things that are akin to the supervision, that's where we see more of the stipends. And we're seeing that more widely utilized across the industry now. We did collect quantitative data around that. What is that median value? We've got some other low and high numbers that we've baked into the 25th and 90th percentile type ranges that we can extend. But we've utilized that in some of our fair market value work, try to prescribe some value associated to overseeing APPs. How does that relate to what the market bears? Some of that. So I thought it was just beneficial or insightful to note that specific area.
Yeah, I thought that was one of the more interesting trends that kind of wove all through the survey is around new versus experienced APPs. We saw it's much easier to recruit newer APPs than experienced APPs. Most hospital executives and practice executives are seeing that as a trend. At the same time, within the survey, we found physicians are spending up to 3x amount of time supervising new APPs versus experienced APPs. And that was also the time commitment of supervision of APPs was one of the biggest barriers to physicians wanting to actually bring in APPs and supervise them. A lot of these things wove throughout the survey results.
And what's the plan going forward for the survey in terms of how you're hopeful to expand it, utilize it in the future, add additional questions, concerns, being able to track, implement those types of things in the future?
So I'll let Matt talk about the timing of it in just a moment, but we updated the survey this year with several new questions that gave us some insights into things that we previously didn't ask. But we were very thoughtful on making sure that we retain the same questions that we asked last time so that we could trend information. We did expand slightly some of the questions. I think that we will probably expand it a little bit further when we release the next survey so that we can capture even more. I think probably operational insight, functionality as far as the care model, some of those types of insights. We do have some of those insights, but I think we can go deeper in that regard. And so I think that's an area that we may expand upon as we do a refresh. But Matt, tell us a little bit about the timing in terms of how often we're going to refresh our survey and release it.
Yeah, so we are planning to update the survey every other year. We felt, given the kind of more strategic nature of the questions and whatnot, a 2-year cadence made a lot of sense.
I think we try to collect some insights in terms of how long it takes respondents to go through and fill out the survey. You have any of those stats, Andy?
Yeah, based on the survey platform that we use, we saw it was about 30 minutes roughly to go in and fill out all the questions.
We recognize there's a bit of a time commitment, but also if someone could just block off an hour, I think that this can be more than ample time to get through and fill it out. We make sure that we reach out, try to ping others within our network, make sure that we're getting good representation. reminders sent out on, please fill this out. And then we'll get the results back, go through and interpret everything, get it all structured, create graphs, all that kind of stuff to make it a little bit easier to digest and understand takeaways. And then Craig, if you don't mind, just tell us a little bit about how we've made this available to our client base and those that we come in contact with. I know I've pushed it out to a number of my clients that I work with regularly and have relationships with. But we've made this available where people can go download it. Where can they find this?
Yeah, that's exactly right. The survey itself, we've got it posted. We actually did a more detailed podcast for the AAPCP organization, which deals with provider compensation. I would suggest if you would like to get your name in the pot to make sure we invite you to the survey next time, is to go ahead and just email me directly at chunter@cokergroup.com, chunter@cokergroup.com. That way we'll make sure we get your information in to the automatic ads for the survey next time. And in terms of being able to locate the survey, it is available through our website. If you happen to be listening to this telecast on our YouTube channel, you'll actually see a link to the survey on the description. So we appreciate it and hope you find that helpful. And I think that is one of the benefits of participating in the survey. We not only provide a detailed copy back with our observations regarding the answers and perspectives on the survey, but in many cases, our clients have, or the respondents have requested a phone call to go in and see how their particular organization compared to the overall survey data. And that actually even provided some good back and forth related to what they would like to see even in future surveys. So we're always trying to fine tune it a little bit, and getting feedback from respondents has been extremely helpful and I think beneficial for them. And a lot of times it actually confirms maybe a gut feeling that you have about what's occurring, but then it also may be a little bit more strategic in the context of, well, what are organizations maybe of different size doing? And if you're in a growing organization, you may find yourself in that scenario, and certainly in a competitive environment where um, questions related to, are they under non-competes or contractual relationships, those things are very important, because in competitive markets, if they can just walk from one practice to another practice, obviously that's a concern. So hopefully that helps. Alex, Matt, any other final comments before we wrap up today?
Just to emphasize what you were saying, I think we did get a lot of receptivity from our client base and others within our sphere of influence about the survey. We've used it to have dedicated conversations with them. And it can play a role as well in how you shape and evolve your provider mix. Recognizing that physician supply is getting stretched thinner and thinner. There's a growing shortfall, deficit of physicians with the growing and sickening population that we have. APPs are making their way into part of the overall care delivery strategy of organizations. And depending on where you're located in rural areas, it may be that is the provider strategy that you have. And so we've been talking with organizations about that, have some of those insights, can get together and talk about that from a strategic perspective as well, as organizations set forth what their long-term strategy and visioning looks like. I think the survey can help provide some insights in that respect. And we're always happy to talk with organizations to help shape that strategy as well.
Yeah, just tagging on to that, I'll say that APPs are significant contributors to the goals of healthcare organizations, and leveraging APPs can help organizations drastically expand patient access, help reduce physician burnout, and expand service growth. Going forward, we see APPs being an ever more significant piece to the healthcare puzzle and making sure that we provide quality care to patients. So that's one of the main drivers toward this survey and why we're conducting it now.
Very good. It's great. I'm glad we were able to get together and talk about some of the details. We're always happy to talk about anybody that has an interest in this, and we can layer in our thoughts, observations alongside our knowledge of billing rules, what Medicare's, how they're treating and reimbursing providers as well, to get into more of a financial use case, pro forma development, those types of considerations as well. With that said, I think we can wrap it up, and thanks guys for the time.
Thanks, everyone.
Thank you.